Every mom dreams of a smooth, uncomplicated birth. But did you know that up to 60% of the complications are actually preventable? Hello, beautiful ladies. I am back today, Dr. Disha MD, your holistic gynecologist. Welcome back. And today we are talking about something that can feel a little scary: birth complications. But more importantly, we are going to focus on what you can do to reduce those risks and give yourself and your baby the very best chance at a smooth and uncomplicated birth. That's all we want, right? The great news is there are many things within your control that can help to lower the risk of complications. In fact, research shows that there are firm evidences that preparing your body for a healthy pregnancy, physically, mentally, emotionally, before, during, and even after pregnancy care can improve the likelihood of a normal, uncomplicated pregnancy. That means that what you do right now matters. There are a lot of things which you can control, and your power lies in that. Modifiable risk factors include something as simple as eating anti-inflammatory foods rich in fruits, leafy greens, maintaining a healthy body weight, managing blood pressure and heart rate, reducing stress, it's a big one, fixing your digestion, balancing your hormones from the root cause. Now, these simple lifestyle steps can change the outcome dramatically. And when I say fixing, I do not mean just pop a pill. What I mean is really healing the underlying root cause of the problem. Okay, so let's talk about support options during your birth. It's very important to feel safe and supported during this important period in your life. Find your community to support you. It could be your family, friends, or even support groups. Education is power, so holistic childbirth education programs can be a game changer. Clinical trials show shorter labor, fewer interventions, and higher vaginal birth rates. And moms often feel calmer and more empowered once they are educated and supported. Now, a word of caution on herbs and teas. Now, even though natural products seem safe, not all are studied in pregnancy. Okay, so some may increase the risk like preterm birth or developmental concerns. So please use them under expert guidance only. A word on caffeine. The latest research suggests that overdoing caffeine may not be great in pregnancy, so try to reduce it or limit it. Exercise can be a game changer. For many decades, women were told not to exercise in pregnancy, but the evidence is crystal clear now. Exercise is safe and powerful. It shortens labor up to 2 hours, reduces C-section rates, and improves baby's brain development and stress resilience also. Even walking daily can make a big difference. It lowers anxiety, depression, as well as effectively as medicines may be. Stress and mental health is very important because your stress levels can affect your baby's brain. So managing stress is not selfish, it is essential. Some powerful tools could be, my favorite is deep breathing with long exhales, yoga, meditation, cold water splashes or showers, which activates the calming vagus nerve, laughter, singing, connection with loved ones. Safe supplements like magnesium, L-threonate and oat straw can also be helpful in pregnancy. Remember, every day do something for your body, mind and soul. Then breastfeeding is very important, ladies. It is nature's superpower. If possible, breastfeeding is the single most possible thing you can do for your baby's immune system and brain growth. Research shows that it boosts IQ, lowers the risk of ADHD, autism and behavioral disorders. Breastfeeding provides custom-made immunity and microbiome support to your baby. Even partial breastfeeding is helpful, but exclusive breastfeeding has the greatest advantage. Most important, balancing your hormones before and during pregnancy can ensure that you have a good milk supply for your baby, and you can also seek a lactation consultant services. And if you must formula feed, adding DHA and infant probiotics can help to support baby's brain and gut health. Now, a word of caution about antibiotics. And baby's microbiome is very important. Be careful with the excessive use of antibiotics in babies, which can actually disrupt the microbiome and immunity long term. Now, sometimes antibiotics are indicated and they have to be used, but it should be supervised by an expert and used only when necessary. Ladies, to wrap up, you have more power than you think. By nourishing your body, moving regularly, managing stress, making informed choices about providers and interventions, and even protecting your baby's gut microbiome, you are laying the strongest foundation for your child's lifelong brain and health. Take a moment today to reflect. What are your risk factors? Which ones can you change? Who do you want on your birth team? And remember, you don't have to do this alone. I'm here. I believe that education is the key because knowledge is power and awareness is the first step. Thank you for walking this journey with me. You are doing something very special. You are shaping the next generation. If this resonates with you, write down your action plan today. And remember, Mom, every little step you take is a gift to your baby's future. So ladies, keep learning, keep growing, and take very good care of yourself.